after going through this external auditory canal, we will examine the tympanic membrane. Now, the normal tympanic membrane is pearly gray. This is pearly gray. The color of normal tympanic membrane is pearly gray. It is translucent and it is mobile. So the normal eardrum is pearly gray, translucent and mobile. Now we will notice the shape of tympanic membrane. The tympanic membrane should be relatively flat or slightly concave inwards. So this concave part is facing inwards and the convex part of the tympanic membrane faces out. And this tympanic membrane is set in the annulus at the angle of 55 degrees. So it is set, this tympanic membrane is set in the annulus at the angle of 55 degree. Then we will notice the mobility of tympanic membrane. The tympanic membrane should move in response to pressure changes during pneumatic otoscopy. So we do not perform pneumatic otoscopy in all cases. Then we will see the cone of light. Suppose this is tympanic membrane of right side. Okay, we will divide it into pars flaccida and then this portion is pars tensa and this has become tense due to inward pull of handle of Malleus. The handle of Malleus attaches at the point, and that point where the handle of Malleus is attached to the tympanic membrane and it pulls it medially is known as umbo. So in normal tympanic membrane there is inward pull at the attachment of handle of Malleus and this pull is known as umbo. Where the from the umbo, a cone of light goes anteroinferiorly like this. So this is cone of light. The base of the cone is attached at the annulus like this, and this cone of light is present at the anteroinferior quadrant of the eardrum. So the apex starts from the umbo and it goes down the cone of light and its base is at the annulus of the tympanic membrane. So this is handle of Malleus. Here it pulls the tympanic membrane. This is tympanic membrane inwards. And due to this inward pull, the tympanic membrane becomes tense, and the muscle that acts on the Malleus is tensor tympani muscle. Okay, so this is normal tympanic membrane, and normally we see cone of light. So this cone of light is basically a reflection of otoscopic light on the tympanic membrane, which is typically located in the anteroinferior quadrant at 5 o'clock in right ear and 7 o'clock in left ear. So this is right ear of the patient. It is located at 5 o'clock position. And if we will see the left ear, it would be located at 7 o'clock position. Malleus is the handle of Malleus is often visible with its long process, and the short process of Malleus is extending from the tympanic membrane. Now, so we discussed the normal tympanic membrane during otoscopic examination. Normal tympanic membrane is pearly gray or pearly white, concave where we see it, and convex towards the middle ear cavity. It is set at the angle of 55 degrees and we visualize this cone of light at the anteroinferior quadrant. We see the long process and short process of the Malleus during the normal otoscopic examination of the ear. If we see in detail, there is again, this is tympanic membrane, this is external auditory meatus, and this is stabilizing ligament. This portion is the middle ear cavity, and here the tympanic membrane is attached, and this we can see with the otoscope up to here. But due to translucency of the tympanic membrane, we can also appreciate some parts of the middle ear cavity. So after that, we discuss again. This is a picture of normal tympanic membrane. This is a live view, and if infection or inflammation has occurred, this cone of light will be absent. This cone of light will also be absent in cases of retraction pockets, and this cone of light will also be absent in cases of the perforation of tympanic membrane and due to any infection and due to fluid in the middle ear cavity. This cone of light can be absent. This is the lateral process of Malleus. This is manubrium of Malleus, and this is the cone of light, and this cone of light is present at the anteroinferior portion of tympanic membrane.